What if everything we've been told about autoimmunity is wrong? I'm Elizabeth Yarnell. After awakening partially blind one morning in 1999, a doctor told me my multiple sclerosis would put me in a wheelchair within 10 years. I refused to accept that as the end of the story, so I started investigating. Welcome to the Inflammation Investigator, the podcast that uncovers the inflammation lurking underneath your ailments. Because autoimmune and chronic conditions should not be viewed as death knells when they are actually alarm bells. I'm a traditional naturopath and founder of the Inflammation Academy. And in 2 episodes every week, we dig into what conventional medicine might be missing. If you're living with chronic or unexplained symptoms, this investigation is for you. Your body has been trying to tell you something. Let's start listening.
In the last episode, we talked a little bit about what inflammation might look like or feel like, and what you might feel like if you are facing a situation where you are chronically inflamed. Today, let's talk a little bit more about natural healthcare, specifically traditional naturopathy, since I'm a traditional naturopath. And I'm going to read some things to you to make sure that I don't forget anything important that I want you to know. So if you are unfamiliar with traditional naturopathy, let me familiarize you with the healing knowledge of our ancestors, as well as the cutting-edge health practices backed by hard science. A traditional naturopath utilizes non-pharmaceutical solutions for healing that may include diet, vitamins, minerals, herbs, homeopathy, energy, meditation, aromatherapy, movement, acupressure or acupuncture, massage, hydrotherapy, breathing, sauna, electricity, and many other familiar and esoteric therapies. Naturopathic doctors are different from traditional naturopaths in that they have a combination of allopathic medical and naturopathic training. They are generally licensed and can do everything a medical doctor can do alongside offering natural therapies. Unlike naturopathic doctors, traditional naturopaths do not prescribe pharmaceutical drugs, perform surgeries, or make medical diagnoses. So there is a difference between traditional naturopathy, conventional allopathic medicine, functional medicine, and evidence-based medicine. Let's dive into this a little bit. Most Western doctors practice conventional allopathic medicine and begin by matching symptoms to a diagnosis in order to recommend a pharmaceutical drug, a surgical intervention, or both. Allopathic doctors excel in emergency medicine and are the people to go to after an accident or injury. If I'm in a car accident, by all means, take me to the nearest hospital. Beyond reassembly or removal of body parts, allopathic medical doctors focus on palliative relief from pain and discomfort by using pharmaceuticals to either block pain receptors or mask uncomfortable sensations, or attempt to kill undesirable cells without killing the patient in the process. While antibiotics are extremely valuable for addressing stubborn bacterial infections, such as strep throat, other conditions, such as high blood pressure, may require the patient to continue a drug indefinitely in order to keep symptoms at bay. The goal of pharmaceutical therapies is to provide relief from the unpleasant symptoms of inflammation. While we can be grateful for the relief, it's important to realize the difference between temporary pharmaceutically induced relief from symptoms and a foundational healing that addresses and resolves the root cause of the inflammation. This is the focus of functional medicine. True healing means that the inflammation and the symptoms it manifests no longer flare up to bother you. Both functional medicine and traditional naturopathy lean heavily on evidence-based medicine, which is when a healthcare practitioner combines their clinical expertise, the best available scientific and anecdotal evidence, and their clients' personal characteristics and preferences when making suggestions. To be clear, I am not saying don't take your prescribed pharmaceutical medicine. That's between you and your allopathic doctor to decide. However, whether you choose to take a pharmaceutical drug or not, it is still essential that you be taking steps and making lifestyle changes in order to reduce inflammation and help your body feel and function better. Whether or not you take a drug, you still have to eat. So you might as well be eating the right foods to help your body heal. Regardless of the path you take or the types of doctors you consult, we all have the goal of slowing, reversing, and improving a life that may be ravaged by chronic inflammation. Yet, we can all acknowledge that some people with autoimmune conditions like MS do better than others. This podcast is intended to help you understand why your body is malfunctioning and why you should act to change that state. Remember, this is your one and only life, and only you can save yourself. In the next episode, we'll talk more about who might benefit from listening to this podcast and why you might want to continue to listen to the coming episodes. We'll see you then.
And that's another case filed on the Inflammation Investigator. Remember, every symptom is your body's way of communicating. We just need to learn the language. If today's episode sparked something for you, I want to hear about it. Share your own investigation discoveries with me on social media at Elizabeth Yarnell, or find me at elizabethyarnell.com. Your experience could be exactly what another listener needs to hear. And make sure you're subscribed so you never miss an episode. And here's the thing about investigations. They work best when you're not going it alone. If this podcast is helping you uncover the answers you've been searching for, please like, rate, subscribe, and review, and share it with someone who needs to hear this message. As a new podcast, these actions mean more than you know. Want to dive deeper into your own inflammation investigation? Head over to inflammationinvestigator.com, where you can take my free inflammation quiz to uncover which hidden triggers might be affecting your health. Until next time, this is Elizabeth Yarnell, your inflammation investigator, reminding you that the solutions to your health issues are out there. Let's find them together.